The increase in cases and the concern about hospitalizations have medical experts thinking about how to handle a possible influx of patients. The FDA has approved 2 antiviral pills in the last 24 hours, but really neither is widely available for use just yet. So now there are questions about monoclonal antibodies. News 6's Treasure Roberts joins me in studio now. So Treasure, availability and effectiveness could be potential issues.
Yeah, monoclonal antibodies are known to treat COVID-19 related illness and prevent hospitalizations. But the problem now, doctors say they're not so sure the highly sought treatment is as effective as it once was. High demand and low supply, monoclonal antibody treatments aren't easily accessible right now, and doctors say that's for several reasons.
Well, we're seeing a lot of demand now. We know that the percent positivity rate has shot up. We know that the community spread in the Central Florida area has gone up. And so as a result, the public is also more aware about the benefits of monoclonal antibodies.
The treatment is for people who've been diagnosed or exposed to someone with COVID-19 and are at high risk for progression of severe illness, hospitalization, or even death from the virus. Doctors tell News 6 there's a shortage of monoclonal antibodies around the state, causing some treatment centers to halt appointments until further notice.
One of the issues that we are limited in right now is that there may be shortages of monoclonal antibodies, and we are continuing to work with the state to make sure that we get the ones that we can that are effective.
The bigger issue, doctors worry the current treatments may not be effective.
Yeah, we're sort of between a rock and a hard place right now.
So we have seen that the Omicron variant, with its myriad of mutations that have occurred, are less effective to some of the monoclonal antibodies that have been given.
Dr. Vincent Chu with Advent Health says that includes prominent brand Regeneron. Sanford Fire Medical Director Dr. Todd Husty says the unvaccinated are rolling the dice, knowing now antibody treatments aren't entirely reliable.
We've just lost a good backup approach to what happens if you get ill, especially if you're unvaccinated.
Doctors acknowledge the newly authorized COVID-19 pills as emergency treatment, but emphasizing they won't be widely available for months. They're strongly encouraging people to make the vaccine and booster shot the first line of defense.
There's even more reason to go get vaccinated. There was before, there's even more reason to go get vaccinated. We may not be able to help you if you get worse disease or keep you from getting worse disease because we don't have the monoclonal antibodies anymore.
Dr. Chu with Advent Health reiterating what Dr. Husty said. Although COVID-19 vaccines are less effective against Omicron, they still provide protection, especially when coupled with a booster shot. They're still working with the state of Florida to get more antibodies that can combat Omicron. Matt.
Treasure, thank you.